Welcome back to Healthcare Consumerism Radio. This is Brent Marcee, Managing Director of the Institute for Healthcare Consumerism, along with Doug Field, CEO and founder of the Institute for Healthcare Consumerism. And joining us on this segment is Marcee Chmait. She is the president of SpendWell Health. Marcee, good morning.
Good morning.
How are you today?
I'm very good, thank you.
Now tell our audience a little bit about SpendWell Health.
Absolutely. SpendWell Health is an online marketplace where consumers can shop for healthcare services and actually make purchases directly. And the reason why we have built SpendWell is we believe that transparency is great, but consumers need to have actual known prices and be able to make healthcare purchases using their limited healthcare dollars.
Now, when you launched SpendWell Health, what were some of, tell our audience some of the trends that you saw in the marketplace and the need for the solution that you guys have?
Absolutely. We are seeing four trends that are actually leading up to our direct pay solution, and that is transparency. And as we know, transparency is being implemented on a very large scale. I believe about 73 or so % of employers are implementing transparency tools, which is wonderful. That's the first trend. The second trend is that states are mandating, and all payer claims databases are also being implemented. So governments are recognizing the underlying issue around price is really a core value that we need to install in our healthcare system. The third major trend that we're seeing is direct contracting, and large employers especially are taking control, if you would, of how they contract with providers in their local markets. And then the fourth is consumer demand. So as more and more consumers or employees are enrolled in high-deductible health plans, consumers are finding themselves essentially self-insuring under their deductibles. And so this trend is causing, consumers to, kind of rise up, if you would, and demand that they have the right tools available for them.
Hey, Marcee, this is Doug, and great to have you in the program, and really appreciate you and your team being with us out west. Talk to us about this new healthcare consumer. What's the consumer look like? I mean, and what do they value?
Absolutely. So the consumer is like any other consumer in any other industry. They're really looking for cost, convenience, and quality. But in healthcare, sometimes those simple things that they're looking for are hard to find. But even if we give them true cost and convenience and quality, they're also looking for other conveniences or other components that they would get if they were, buying a TV or any other consumer good. Mm-hmm. They're looking for expanded hours from their providers. People aren't interested in taking off work necessarily to receive routine care. They want to be able to communicate more efficiently with their provider, so using technology and email, text to be able to get their needs met. Which means that they should be able to use their smartphones and carry their medical records with them. They also want to be brand loyal. And one of the things that we're finding is that, a lot of people say that, people are wedded to their primary care physician. Well, some are and some aren't, but they really do want to have that sense of a relationship, which leads me to also understand that healthcare is a relationship business, and how do we make that interaction, that encounter with providers, much more personalized? Right now it's very transactional. So those are the things that we're finding consumers really want to have as they're engaging in the healthcare system.
Marcee, many of the health plans out there are focused on an ACO strategy. Why is a retail model an emerging model that is going to sustain itself in this industry?
Yeah, so at SpendWell, we actually see the market bifurcating. So there are those providers and those organizations that are taking an ACO approach, which is very well warranted. And then there's the other side of the spectrum, if you would, where providers really don't want to be part of a managed system, nor do consumers, and so there's this retail model. And for those organizations where they don't want to be managed, provider groups and or consumers, the retail model makes a lot of sense. It's highly personal, it's known, and it's much more simple.
How can this, Marcee? How can this help a self-funded employer? with their benefit plans? Where does the retail-based model fit with them?
Yeah, so the way that we're approaching the self-funded market is, employers have the opportunity to really make wholesale changes around how their consumers purchase health care. So today, employers are putting in transparency tools, which are wonderful because consumers can actually see how much services cost. But if you put in an actual marketplace where your employees or your consumers can go and buy health care at known prices in an open marketplace, which actually drives provider price competition, we're finding that the results on our marketplace platform are actually oftentimes better than that of the negotiated fee schedule, especially for routine care. So by putting in this type of solution, employers and consumers are actually able to bring rational, supply-demand principles to market and continue to, connect the consumer and the provider.
Marcee, talk to us a little bit about the provider community that's out there. Are they engaging in this retail model that you're talking about? And, are there challenges that they're facing because this space is changing so quickly?
Yeah, again, I think it kind of goes back to how the landscape is bifurcating. But there are large groups of providers that really want to have the autonomy to practice medicine and not to be held to all the administrative rigor, if you would, of working with an ACO model or an insurance company. And so really what you're finding is there's new retail models emerging, whether it's retail clinics, whether it's concierge models or house call models. Providers really just want to get into the business, if you would, of practicing medicine. So what we're finding is we're asking providers to participate on our platform is that they can actually curate their services and post their prices, and what we give them in return is the ability not to have to check eligibility, file a claim, reconcile the remittances, and have to send patient bills. Once they actually see their patients, they can get paid right away. So our administrative process simplifies that for the provider, and providers are thrilled that they can just see their patient and get paid for the value that they provide.
Now, Marcee, I think you're dead on the mark there. We work very closely with the group called Doctors for Patient Care, and I've had the opportunity to spend some quality time with some of those doctors, and at the end of the day, they all say, hey, just let us practice medicine.
Right.
Just let us practice medicine. I mean, that's what they want to do. What's been the consumer experience? You launched this when did you launch this, Marcee? How the marketplace?
Yeah, so we actually started in a more beta approach about 3 years ago, and just recently we've raised enough capital so we can go national. But we have about 2,500 or so consumers that have gone through our program, and our customer satisfaction rates are very high. 89% or so would use our program again and refer us to a friend. So our customer satisfaction rates are high, and the reason is because we're actually helping people understand how to buy health care, not just receive it. And we're trying to take out any surprises affiliated with the cost of care because people know what that is beforehand. As a matter of fact, we had one member from Montana who drove all the way to Portland, Oregon, because he could save $1,300 on his MRI. Wow. And so, to me, that was really a testament in terms of how great that kind of data and that kind of experience can be.
Marcee, for through your different sales channels, do you work with say brokers or consultants that are out there that may represent employers? Do you go direct to employers with your solution? What's your model there?
Yeah, so today we're focusing on the large self-funded groups. Of course, working with the consultants is very important to us. And on the mid-sized market, the 3,000 to 5,000, we do work with brokers as well. So we understand that they're a very important part of the ecosystem, and we do think that there's an incredible value that they could bring to their clients and bringing new models to their customers. Do
you do any direct-to-consumer as well?
We started out our business model being direct-to-consumer, but we recently pivoted, understanding that, employers that are putting in high-deductible plans really need these tools, and we can get it to the masses faster. We are hoping, though, that once we become, better known and consumer behavior is understood in this arena, that we can go direct to consumer.
It's a great brand name, by the way.
Thank you.
Yeah. Well, Marcee, I think you guys are very well positioned in this space. I think, the market's kind of circling around you now. In the last minute of the show, kind of give us a few good takeaways for our audience if they're considering your solution and kind of where you see the market moving in the next year.
Yeah, I think direct pay is really coming forward. Employers really have an opportunity to make wholesale changes in terms of how they buy health care and how their employees buy health care. So by putting in a competitive market where prices become rationalized, they can start to see savings, their employees can start to see savings, and they're also going to see higher consumer engagement. And really that's what we're all striving for, right, for us to be very good healthcare consumers. So, SpendWell is really here to make, the consumer experience, the provider experience in healthcare very rational. And being a part of a Cambia Health Solutions company, we're really striving for us to be building new capabilities around being very person-focused and sustainable.
Well, Marcee, thank you so much for joining us on the program today. Hope you have a wonderful weekend out there. And to the rest of our audience, we will talk to you next Friday on Healthcare Consumerism Radio.